if you've got pain in between your shoulder blades, a lot of the time that could be because you don't have good thoracic mobility and it just gets a bit stuck, particularly if you're just at work, sitting all day, or you do lots of driving, you just get a little bit jammed. So someone a lot smarter than me figured out that if you can move a joint in one direction, it actually improves it in all of them. So the idea of threading the needle is to try and make there be some nice movement through your thoracic, and that'll free up the movement, help the muscles relax in general. So always be safe. You're meant to feel better after you're doing it, or even while you're doing it. So if it's sore, please stop, seek professional advice. But heaps of different ways you can do it. If that's not quite, if this is not, stance is not comfortable for you, you can go down on your knees, on your elbows like that. But essentially, all you want to do is take this hand, and they call it thread the needle because you thread it through like that. And you go as far as you can. And that'll have a nice stretch for your rhomboids. Helps all the muscles open up in your spine, the joints open up in your spine. And it gets a nice little stretch for your lats. And then you're coming back up like that. Nice and easy. And then you're going to make sure you do the other side. By the time you've done that, 10 to 15, you should be starting to feel a lot freer and better. The other good thing about that is if you are on your hands like this, or even on your knees, making sure that you're keeping that shoulder active is going to help your shoulder stability. It's just really good for your shoulders. So all the way through.